Hey everyone, ready for a deep dive into something a little less pleasant maybe? We're going to tackle mastoiditis today.
Mastoiditis, yeah.
You know, a bunch of you sent in articles and research on this, so it's clearly something you're interested in.
It is.
And I get it. I mean, a bacterial infection behind your ear, yikes.
Right. Not something you want to ignore. It's like it can really sneak up on you.
That's what's kind of scary about it, right? You don't really hear about it until, bam, it's a problem.
Exactly. And the thing is, it often starts with something we all know too well. Middle ear infections.
Ah, ear infections. Yeah, those I remember. Had my fair share as a kid. Never thought it could lead to something like mastoiditis, though.
Well, think of it this way. Your middle ear, it's like a little room, right? And that bacterial infection, that's a fire smoldering in the corner.
Okay, I like where this is going.
If you catch it early, you put the fire out, no big deal. But if you ignore it,
Uh-oh.
it can spread, right? Like burst into the next room. And in this case, that next room is your mastoid bone, right there behind your ear.
Okay, that image is going to stick with me. I can practically feel the heat. So, takeaway number one, folks, ear infections, especially in kids. You gotta deal with them fast. No waiting around hoping they'll vanish on their own.
Couldn't agree more. Early intervention is key, but let's say it doesn't happen. For whatever reason, the infection gets worse. What should people be watching for?
Yeah, what are the signs that it's gone from a simple earache to something more serious?
Pain, for sure. But not just your average earache. This is like a deep, throbbing pain behind the ear.
Oof, I can imagine.
The kind that makes you want to press on it. But even that hurts. You might also see redness, swelling in that area.
Yeah.
And get this, sometimes the swelling pushes the ear outward, so it like sticks out.
Wait, the ear actually sticks out. Okay, that's something you wouldn't miss.
Right. And then you might have discharge from the ear, fever, chills, feeling generally awful. Some people even have trouble hearing in that ear.
So basically, you feel like you got hit by a truck and your ear's throbbing. And what happens when you go to the doctor? They can't just, like, take a quick look, can they?
No, they've got to do some investigating. Start with a physical exam, checking your ear, pressing gently on the mastoid bone. If it's tender, that's another clue. But to be sure, they'll probably order some imaging scans, like an X-ray or a CT scan.
I was going to ask about that. Do those actually show the infection itself?
Oh, yeah. Think of it like they shine a light right through that bone, shows exactly how far the infection's gone. And sometimes they'll do blood tests, too, to see how much inflammation there is in your body.
Okay, so you've got your diagnosis. Now what? What's the typical game plan for treating this?
Well, the good news is we've got weapons against this infection. Antibiotics are usually the first line of defense, and they work really well most of the time.
Awesome.
For milder cases, you can take them orally. But for the more severe ones, you might need intravenous antibiotics.
Intravenous, so that means hospital, right?
It could, yeah. Especially if the infection's really bad or if those oral antibiotics aren't doing the trick. The goal is to hit it hard and fast, prevent any complications.
Right, makes sense.
And of course, there's medication to help with the pain and inflammation, because mastoiditis, it's definitely not a walk in the park.
So while those antibiotics are doing their thing, what can people do for the discomfort? Is it like over-the-counter stuff or something stronger?
It all depends on how bad the pain is, but the doctor might give you something a little stronger than what you can get at the drugstore. They want you to be as comfortable as possible while your body fights this off. But we got to talk about surgery, too.
Oh, yeah, surgery. Was kind of hoping we could avoid that topic. Is that a common thing with mastoiditis?
Thankfully, not always. It's kind of like a last resort. Like if the antibiotics aren't working or if there are some complications, maybe an abscess forms or there's damage to the bone itself.
So if it gets that serious, what kind of surgery are we talking about here? Sounds pretty intense.
There's a couple of different things they might do. One is a mastoidectomy, where they actually remove part of that infected mastoid bone.
Wow.
And another one's a tympanostomy. That's where they make a tiny cut in the eardrum to drain fluid and relieve the pressure. I know it sounds scary, but these procedures, they work. And they can prevent long-term damage.
Okay, that's good to know. That there are options, if things take a turn for the worse. But honestly, hearing all this, I'm thinking prevention is the best way to go here.
You got it. And the great thing is, there are actually some simple but really effective things you can do to lower your risk, like way lower it.
All right, so let's give our listeners those preventative tips. What's at the top of the list?
Remember that fire analogy we talked about?
Yeah.
Well, the key is to stop that little spark from becoming a wildfire.
Right.
That means dealing with ear infections quickly and the right way. Don't let them linger.
No messing around with ear infections. Got it.
Yeah.
What else?
Basic hygiene goes a long way. Washing your hands a lot, especially if you're around kids who get ear infections often. That's huge. And if you smoke, well, quitting is probably the single best thing you can do for your whole body, including your ears.
So we're saying quit smoking again. We say it a lot on this show, but it's always worth repeating. What about alcohol? Does that have an impact?
Yeah, if you drink too much, it can weaken your immune system, and that makes you more vulnerable to infections. So, like with a lot of things, moderation is key.
Good advice. Now, what about diabetes? I know that can affect circulation and wound healing. Does it increase the risk of mastoiditis too?
Yes, people with diabetes are more likely to get infections generally, and that includes ear infections. And if your blood sugar is out of control, well, it can make it even harder for your body to fight off infection. So that can make mastoiditis more likely.
So we've got a pretty long list of risk factors here. Everything from age and how your body's built to underlying health conditions and lifestyle choices really makes you think about how complex our health is.
Yeah, there's so many factors involved. But the more we understand about them, the better we can take care of ourselves, right?
Absolutely. And speaking of taking care of ourselves, we were talking about honey earlier as a potential remedy. I think it's worth delving into that a bit more.
Definitely. It's great that people are curious about alternative options, but it's important to be cautious.
Right. Not just jumping into things without knowing the facts.
Exactly. And when it comes to ear infections, honey seems to be the big one.
Oh, yeah, honey. It's been used for ages. I mean, I've heard of it for coughs and sore throats, but ear infections.
Well, there's some research out there suggesting it might have antibacterial and anti-inflammatory properties that could be helpful.
Interesting. How does that even work, though? Like, you just pour honey in your ear?
One method is using honey eardrops. You warm up a bit of raw, unpasteurized honey, we'll come back to that part, and use a dropper to put a couple of drops in the ear.
So you're putting honey straight into the ear canal. I guess it coats the area and fights the bacteria.
That's the idea. You tilt your head for a few minutes so it settles, and do this a few times a day. It's thought to reduce inflammation and maybe even stop those bacteria from growing.
Okay, I kind of see how that could work, but you said the honey has to be raw and unpasteurized. Why is that?
Good question. See, raw honey has more of those beneficial compounds, the stuff that gives it those antibacterial and anti-inflammatory powers. Pasteurization, while great for food safety, it can destroy some of those good compounds.
So it's all about keeping it natural, huh?
Exactly.
I'm also thinking about the fact that we're talking about putting something directly into the ear. Are there risks with that?
That's a really important point. You absolutely need to talk to your doctor before trying any home remedies, especially for ear infections. They can get serious if not treated properly.
Right, because those complications we talked about, not worth the risk.
Exactly. Your doctor can look at your specific situation, and help you weigh the risks and benefits.
Always good advice. So honey eardrops may be helpful, but gotta use them carefully. And with your doctor's okay, anything else about honey as a remedy?
Always more to learn, right?
Of course.
Another thing to remember, honey can cause allergies. So you got to make sure you're not allergic before putting it anywhere near your ear.
Good point. I hadn't thought of that. So honey, a potential helper against ear infections, but gotta be smart about it. What about some of those other remedies? We saw garlic mentioned a few times.
Ah, garlic, the cure-all, right?
Much.
It's true, garlic's got some powerful antibacterial stuff going on.
Yeah.
And some people swear by it for ear infections. But
I'm hearing a but here.
there's some back and forth about whether putting it right in your ear is actually safe.
Oh.
Some folks think it can irritate the ear canal, maybe even damage it. That ear canal's pretty delicate.
So it's like you might get a benefit, but there's also a risk. I see why this one's a bit controversial.
Exactly. And that's why, again, talking to your doctor before experimenting is so important. They can help you make a good decision based on your situation.
Makes sense. But garlic. Potentially helpful, but proceed with caution. And always check with the doc first. How about those other remedies we saw? Warm olive oil, steam inhalation, those kinds of things. Do any of those actually work?
Some of those are more about easing the symptoms, not really fighting the infection itself.
Okay.
Like warm compresses can help with the pain and swelling. And steam inhalation can sometimes open up those clogged eustachian tubes. It makes it easier for fluid to drain.
I've heard some folks say warm compresses are useless for ear infections. What do you think?
It really varies from person to person. A warm compress won't cure the infection, but it can definitely make you feel better. Take the edge off that throbbing pain. It's kind of a way to manage those symptoms while the antibiotics are working.
So more like supportive measures than miracle cures.
Yeah, that's a good way to put it. And like with any home remedy, even if it seems harmless, check with your doctor first, especially if you're dealing with something like mastoiditis.
Speaking of mastoiditis, we talked about kids being more prone to ear infections and therefore mastoiditis. Why is that exactly? Is it just because their immune systems are still developing?
That's part of it for sure. Those little immune systems are still learning, so they're more vulnerable to all sorts of infections. But there's also the shape of their eustachian tubes.
Oh, yeah, those tubes that connect the middle ear to the back of the throat. Vaguely remember those from, like, middle school science class. What's different about them in kids?
Imagine a kid's eustachian tube, like a playground slide, but with a kink in it.
Okay, I'm visualizing.
It's shorter, narrower, and more horizontal than an adult's, so it's much easier for germs to get stuck there and cause trouble.
Ah, so it's like the perfect setup for ear infections, a developing immune system plus those tricky eustachian tubes. No wonder kids get so many earaches.
It's true. Their little ears go through a lot. But it's important to remember that not all kids are the same. Some are just more prone to ear infections than others.
So besides kids and their playground slide eustachian tubes, are there other risk factors for mastoiditis our listeners should know about?
Definitely. Like we said before, a history of frequent ear infections is a big one. It's like your middle ear becomes a bigger target.
That makes sense. Anything else?
Weakened immunity is another factor. This could be because of a medical condition, like HIV/AIDS, or from medications that suppress the immune system. If your body's defenses are down, you're more susceptible to all kinds of infections. Ear infections, mastoiditis, the whole lot.
So underlying health conditions definitely play a role. What about lifestyle? Do our choices affect our risk?
Absolutely. Smoking, for example, is a known risk factor for ear infections and mastoiditis. It messes with those delicate tissues in your ear and makes it tougher for your body to fight infection.
Okay, another reason to quit smoking. We talk about that a lot, but it's important. Now, what about alcohol? Does that have an impact too?
Yeah, drinking too much alcohol can weaken your immune system, making you more vulnerable to infections. Like with most things, moderation is key.
Words to live by.
Right.
All right, so we've got a pretty extensive list of risk factors here. It seems like everything from age and anatomy to underlying health conditions and lifestyle choices can play a role. Really emphasizes how complex our health is.
You got it. The more we understand these factors, the better we can take care of ourselves.
Right.
And speaking of taking care of ourselves, we were talking about honey earlier, and I think it's worth getting into the research behind it.
Oh, yeah, let's dig into that. You mentioned there's some evidence that it might help with ear infections. I'm curious about the details. What have studies actually shown?
Great question. And it's important to look at these alternative therapies critically. Honey's been used for medicinal purposes forever, but the scientific evidence for ear infections, including mastoiditis, it's still a bit limited.
So not a slam dunk, but maybe promising.
That's a fair way to put it. And even if honey does have some benefits, it should always be used alongside conventional medical treatment, whatever your doctor prescribes.
Right, not instead of antibiotics or other important treatments. So just to be clear, we're not saying honey is a magic bullet for ear infections, but it could have potential as an extra therapy used under the guidance of a healthcare professional.
Exactly. It's about balance, combining the best of conventional medicine with the potential of natural remedies, but always being cautious and making informed decisions.
Well said. And I know we've been focusing on the potential upside of these alternative therapies, but let's not forget about the risks. You mentioned talking to your doctor before trying anything. Are there other red flags people should be aware of?
That's a great point. One of the biggest red flags is if your symptoms get worse. If you're trying a home remedy and the ear pain gets more intense, if you get a fever or notice any new, unusual symptoms, stop right away. Contact your doctor.
Don't just wait it out. Better to be safe than sorry, right?
Exactly. Another red flag is any allergic reaction. If you get a rash, itching, swelling, trouble breathing after using a remedy, stop and get medical attention immediately.
So basically, if anything feels off, play it safe and get professional advice.
Absolutely. Remember, these home remedies, they're often labeled as natural, so people assume they're safe. But natural doesn't automatically mean safe. Even plants can be powerful and have side effects, especially if you use them internally or in a sensitive spot like the ear canal.
True. It's great to explore alternative options, but it's crucial to be thoughtful and informed, and always consult with your healthcare provider.
Couldn't agree more.
Well, folks, we've covered a lot in this part of our deep dive into mastoiditis, from why kids are more prone to it to those risk factors, and we even explored some alternative therapies, like honey eardrops and garlic, the pros, cons, and cautions.
Been a good discussion.
It has. Now, in part 2, we'll wrap up this fascinating look at mastoiditis. Be sure to join us.
It has. Now, we were talking about honey before, and I think it's worth looking a little closer at the research on it.
Yeah, let's get into that. You said there's some evidence it could be helpful for ear infections, but what are the specifics? What have studies actually shown?
That's a great question, and it's important to be critical when we're looking at these alternative therapies. Honey's been used for medicinal purposes for centuries, but the scientific evidence for it, working on ear infections, including mastoiditis, it's still kind of limited.
So, not a clear answer yet, but potentially promising.
Yeah, I think that's a good way to put it. And it's important to remember that even if honey does turn out to have some benefits, it should always be used with conventional medical treatment, whatever your doctor prescribes.
Right, not as a replacement for antibiotics or other necessary treatments. So just to clarify, we're not saying honey is a cure-all for ear infections, but it might have some potential as an additional therapy, something to use alongside what your doctor recommends.
Exactly. It's all about having a balanced approach, combining the best of conventional medicine with the potential benefits of natural remedies, but always being cautious and making informed decisions.
Well said. Now, we've been focusing a lot on the potential benefits of these alternative therapies, but we should also talk about the risks. You mentioned that it's crucial to talk to your doctor before trying anything, but are there any other red flags people should watch out for?
That's a really good point. One of the biggest red flags is if your symptoms get worse. Like if you're trying a home remedy and your ear pain is getting more intense, you develop a fever, or you see any new or strange symptoms, you got to stop the remedy immediately and call your doctor.
Right, don't try to push through it or wait and see. It's always better to be safe than sorry.
Exactly. Another red flag is if you have an allergic reaction. If you notice a rash, itching, swelling, or trouble breathing after using a home remedy, stop using it right away and get medical help.
So basically, if anything seems off or unusual, be cautious and get professional advice.
Absolutely. And remember, these home remedies are often advertised as being natural and therefore safe. But just because something is natural doesn't mean it's safe. Even plants can be powerful and have unexpected side effects, especially when used internally or in sensitive places like the ear canal.
That's a really good reminder. So while it's great to explore these alternative options, it's important to do it with a critical and informed approach and always in consultation with your healthcare provider.
Couldn't have said it better myself.
All right, listeners, we've covered a lot of ground today. From the reasons why children are more susceptible to mastoiditis to the various risk factors involved, we even explored some alternative therapies, including the pros, cons, and cautions surrounding honey eardrops and garlic. But before we wrap up, I want to circle back to something we discussed earlier about children being more prone to ear infections, and as a result, mastoiditis. You mentioned that their immune systems are still developing, but is there more to it than that?
Yeah, there's definitely more to it. Their little immune systems are still figuring things out, so they're more susceptible to all kinds of infections. But there's another factor at play here, the structure of their eustachian tubes.
Ah, those tubes that connect the middle ear to the back of the throat. I vaguely remember learning about them in school, but it's all a bit fuzzy now. What makes them different in children?
Well, think of a child's eustachian tube, like a playground slide, but with a bend in it.
Okay, I'm picturing it.
It's shorter, narrower, and more horizontal than in adults, which makes it much easier for germs to get trapped and cause an infection.
Oh, wow. That's a fantastic way to visualize it. So it's like a perfect storm for ear infections, a developing immune system, plus those tricky eustachian tubes. No wonder kids get so many earaches.
That's right. Their little ears definitely go through a lot. But it's important to remember that not every child is equally susceptible. Some kids just seem to be more prone to them than others.
So besides kids and their, let's call them playground slide eustachian tubes, what other risk factors for mastoiditis should our listeners be aware of?
Definitely. Like we mentioned earlier, having a history of frequent or recurring ear infections is a major one. It's almost like your middle ear becomes a more vulnerable target.
That makes sense. What else?
A weakened immune system is another big factor. This could be due to a medical condition, like HIV/AIDS, or certain medications that suppress the immune system. If your body's defenses are down, you're more susceptible to all sorts of infections, including ear infections and mastoiditis.
Right, so underlying health issues can definitely increase the risk. What about lifestyle factors? Do those come into play?
They absolutely can. Smoking, for instance, is a known risk factor for both ear infections and mastoiditis. It damages the delicate tissues in your ear and makes it harder for your body to fight off infection.
Okay, yet another reason to quit smoking. We bring it up often on the show, but it's always worth repeating. What about alcohol? Does that affect our risk too?
Yes, excessive alcohol consumption can weaken the immune system as well, which leaves you more vulnerable to infections. So like with most things in life, moderation is key.
Words to live by for sure. Now what about diabetes? I know it can affect circulation and wound healing. Does it also increase the risk of mastoiditis?
Yes, it does. People with diabetes are generally more prone to infections, and that includes ear infections. When your blood sugar isn't well controlled, it can make it even harder for your body to fight off infection, making mastoiditis more likely.
Wow, we've uncovered quite a few risk factors today. Everything from age and our anatomy to underlying health conditions and lifestyle choices. It really highlights the complexity of our health.
Absolutely. And the more we learn about these factors, the better equipped we are to take care of ourselves. Speaking of which, we were discussing honey earlier as a potential remedy, and I think it's worth exploring the research on it a bit further.
Yes, let's dive into that. You mentioned some evidence suggesting it might be helpful for ear infections, but I'd love to hear more about the specifics. What have studies actually found?
That's a great question. It's essential to approach these alternative therapies with a critical eye. While honey has been used in medicine for centuries, the scientific evidence supporting its effectiveness for ear infections, including mastoiditis, is still somewhat limited.
So it's a bit of a mixed bag then.
Yes, precisely. There have been a few small studies that suggest honey might help reduce the pain and inflammation associated with ear infections. But we need larger, more rigorous studies to confirm these initial findings.
So not a definitive answer yet, but there's potential.
That's a good way to put it. And remember, even if further research shows honey to be beneficial, it should always be used in conjunction with conventional medical treatment as directed by your doctor.
Right. It's not a replacement for antibiotics or other necessary treatments. To be absolutely clear, we're not suggesting honey is a magic cure for ear infections, but it might have some value as a complementary therapy used under the guidance of a healthcare professional.
Precisely. It's about finding a balance, combining the best of what conventional medicine offers with the potential benefits of natural remedies, but always with a healthy dose of caution and informed decision-making.
Couldn't agree more. Now let's shift gears for a moment. We've spent a lot of time discussing the potential benefits of these alternative therapies, but it's equally important to address the potential risks. You emphasize the importance of consulting your doctor before trying anything new, but are there any other red flags that people should be aware of?
Absolutely. One of the most significant warning signs is any indication that your symptoms are worsening. If you're using a home remedy and your ear pain intensifies, you develop a fever or notice any unusual symptoms, stop using the remedy immediately and contact your doctor.
Right. It's crucial not to try and tough it out or wait and see if things improve. It's always better to err on the side of caution.
Exactly. Another red flag to watch out for is any sign of an allergic reaction. If you experience a rash, itching, swelling, or difficulty breathing after using a home remedy, discontinue use immediately and seek medical attention.
So essentially, if anything feels off or out of the ordinary, it's best to prioritize safety and seek professional advice.
Absolutely. It's important to remember that many of these home remedies are marketed as being natural and therefore safe. But natural doesn't always equate to safe. Even substances derived from plants can have potent effects and potentially cause unintended consequences, particularly when used internally or in sensitive areas like the ear canal.
That's such an important point to remember. While exploring alternative options is great, it's crucial to do so with a critical and informed mindset and always in consultation with your healthcare provider.
I wholeheartedly agree.
Okay, everyone, we've covered an extensive amount of information in this deep dive into mastoiditis. We've discussed why children are more susceptible to the condition, explored various risk factors, and even delved into some alternative therapies, weighing the pros, cons, and cautions of approaches like honey eardrops and garlic. Now, let's bring this fascinating exploration to a close in part 3. We'll see you there. Welcome back, everyone. We've been through a lot with this mastoiditis deep dive, and I gotta say, I'm feeling a lot more knowledgeable, maybe a little too aware of ear infections now, but hey, knowledge is power, right?
Absolutely. That's what we aim for here, giving you the info you need to make smart choices about your health.
You know, talking about all this, it makes me think about how much we depend on modern medicine. Can you imagine having mastoiditis before antibiotics?
Oh, it's a good point.
Yeah.
We kind of take antibiotics for granted. Back before penicillin came around in the 1940s, mastoiditis, it was a whole different ballgame. Much more serious, often deadly, especially for kids.
Really? It was that bad?
It was. Back then, surgery was the only option, and even then it was risky. Often didn't work. Imagine going through that knowing even with surgery, your chances weren't good.
That's tough to even think about. Really puts things in perspective. We got to be careful with those antibiotics, make sure they keep working.
For sure. Can't take them for granted. Using them too much or the wrong way leads to antibiotic resistance. That's a big threat to everyone's health globally.
Right. Got to protect these life-saving drugs so they're there when we need them. So thinking back on everything we've talked about with mastoiditis, the symptoms, the risks, the treatments, even those alternative remedies, what's the main thing you want our listeners to walk away with?
The bottom line is this. Mastoiditis can be serious, but it's often preventable. And if you catch it, it's highly treatable with the right care. The key is knowing the link between middle ear infections and mastoiditis, recognizing the signs, and getting medical help fast.
So it's about being proactive, not ignoring those warnings, right?
You got it. Don't try to tough it out or just hope it'll go away by itself. Early treatment can make a huge difference. And don't forget those preventative measures we talked about. Good hygiene, quitting smoking, keeping up with vaccinations. All those things help protect you from ear infections in the first place.
Right. A healthy body is better at fighting off those bacteria before they become a problem.
Exactly. Stay informed, be proactive, and don't hesitate to talk to your doctor if you're worried about anything. Knowledge and taking action, those are your best defenses against mastoiditis.
Well said. And on that note, we've come to the end of our mastoiditis deep dive. Hopefully, we've shed some light on this condition and given you the knowledge you need to stay healthy. Thanks for joining us. Until next time, stay curious and keep learning.